I'll be the moderator for today's session. We'll take 1 hour, and this will be 2 presentations plus 1 question and answer session segment. Please join the discussion through the chat. We do have language interpretation services, and please get to either English, French, or Portuguese channels. Stay away from the off channel. Our session slides will be shared with you and the recordings as well. Just to remind us that this week is International Lab Week. And the theme for the Lab Week 2024 is The Future is Lab. And we hope that you've been taking some time to celebrate yourselves and lab professionals around you who are really doing a formidable job in protecting our future. Back to our session. Today we will focus on the LabCoP country-specific assessment consolidated reports and dashboards. As we are aware, ASLM through the LabCoP project is an initiative that is really supporting knowledge co-creation and exchange to accelerate the scale-up of high-quality lab services on the continent. Our LabCoP work is actually driven by regular standardized assessments that allow for identification of gaps, prioritization of interventions, and monitoring progress. And this, we do it every year. For some assessments, and then others we do once every 2 years. And of course, the results from these assessments feed into the plans that are either domestically funded or those that are then supported by donors that are supporting the multiple ministries of health out there. The scope of our assessment has grown over the years, from initially viral load testing cascade to now integration readiness assessment, the LabNet scorecard assessment, and also the GIS-linked capacity of national lab networks, what we generally refer to as lab mapping. So to help countries in monitoring, measuring, and analyzing relevant data in key areas of lab systems strengthening, we have developed country-specific dashboards that we are going to be running through today so that it can then support you to quickly get access to your historical data and make sense out of those, but then most importantly, use them to prioritize some of the gaps that are in your system and then intervene based on what funding might be available, both locally and through donor funding that I have spoken about. And so to take us through this, we have 2 presenters. The first is going to be Dr. Collins Otieno Jambo. Dr. Collins is a portfolio lead with ASLM. And then the second presenter will be Mr. Michael Maina Waweru, who is a senior M&E manager at ASLM. And so colleagues, allow me to hand it over to Dr. Collins to start us off, and then we'll get to Michael at the end of Collins' presentation. Dr. Collins, over to you.
Thank you, Francis, for the kind introduction. And I see familiar names there, and I'd like to welcome them for this session, and also to welcome our key partners and also members of the Oversight Committee. So George Alemji and Trevor Peter, thank you for joining. So in the interest of bandwidth, I will close my camera and load my presentation. So can you see my slide?
Yes, Collins.
Okay, so I'm going to take you through my presentation, and it's titled Progress in Scale-Up of Viral Load Testing and Laboratory System Strengthening Among LabCoP Countries. So how do we measure progress in LabCoP? So LabCoP currently has 23 members, ranging from South Africa, East Africa, Central Africa, and West Africa. And we employ various assessment tools really to identify what are the strengths within these countries that they can share with other countries so that those that are lacking behind can use the knowledge that has already been created or learned to improve their own systems. We also use those assessment tools to identify weaknesses that can be prioritized for interventions. So the results that we receive here are used to monitor the degree of improvement or continued challenge of that lab system or network over time. This is when we apply the tools either annually or every 2 years. So the outcome evaluations guide also in the implementation of interventions that address most critical areas across countries. So this informs our ECHO sessions as well to introduce topics that mainly address the key gaps that we see across many of the countries. So what are the assessment tools that we have adopted? One, we have the HIV viral load self-assessment scorecard. Then we have a second tool called the GHSA LABNET scorecard, and I'll go through each one of them. Then we have the integration readiness assessment tool. And finally, the lab mapping tool. So since LabCoP was initiated in 2017, we have had over 80 assessments using the viral load self-assessment scorecard. So the founder countries actually have 5 scores across the 5 years. And the most recent ones probably have only 1 because that's their baseline. Then we have conducted 19 integration readiness assessments. We have had 10 countries that have been involved in lab mapping and 5 LabNet assessments. So last year, to help the countries, we consolidated the results from these assessments so that each country received a consolidated report of assessments over the years. So each country, we identify gaps. We also identified what were the next steps that they needed to put in place to address that challenge. And through engagement with LabCoP, we were able to develop work plans that use the best practices that have been gathered in different countries to address certain systemic gaps. So those work plans are then pushed to the request for funding, either to PEPFAR or the Global Fund or any other donor that the country has access to. So let's go through each one of the tools. So the HIV viral load cascade self-assessment tool, this is used to assess the laboratory system function that underlies the HIV viral load cascade. And the tool has 2 sections. We have the qualitative section where we look at 8 key domains, starting from demand creation, specimen collection, specimen transportation, HIV viral load testing. We also have waste management and biosafety, the area of supply chain and equipment management, result utilization, and finally leadership and management. And each country is assessed on their score against those domains. But we also have a qualitative section that looks at the number of reporting HIV viral load sites within the countries. The first HIV viral load cascade, this is the cascade of routine viral load, where we look at the number of eligible patients for viral load, and of those eligible, how many receive a viral load, and how many actually get suppressed. Then that section also looks at the second HIV viral load cascade that looks at the care cascade for those who have unsuppressed viral load. So that measures the number of enhanced adherence counseling sessions that the patients undergo, and also whether they receive a second viral load result so that a decision can be made on whether to switch them or to stay on the current regimen. This viral load assessment tool is applied every year. And down here, we can see some countries undergoing that assessment. So Gabon, Malawi, Uganda, and Congo teams. as examples. So in the report, we look at each domain and also identify what is the weakest indicator. So for example, for this country, as an example, in 2022, in the domain of demand creation, we have our legends at the bottom. So a red typically represents capacities at foundational level or non-existent. Stage 2, which is orange, is moderate level. A yellow usually means strong technical or managerial level. And a green is where we want to reach, which is advanced level. And we used these flags in those reports to indicate what were the lowest indicators that the countries needed to pay attention. So for example, for this country, under demand creation domain, they need to put more focus on their strategy for increasing viral load test demand. So it might be there, but it's not used continuously to improve demand. And they also need to look at their awareness campaigns for people living with HIV. So these countries got a strong technical or managerial level because you only are strong as the weakest link. So the weakest link is at 3, so you score at 3. And we also looked at the progression from 2021. So stable means nothing changed. So nothing was done about the strategy or awareness campaign, probably because they didn't get funding to optimize that. So that's what we give to the countries to prioritize. And so in terms of the 11 founder member countries, so there were 11 at 2017 when LabCoP started. In the area of demand creation, only 64% had a strong technical or managerial level and above score. But in 2022, having put interventions in place, almost all countries now are at managerial to advanced level. So looking at the quantitative sections that I mentioned, with a red showing lack of availability of data and green showing presence, we see that for the first cascade, for routine viral load, countries have most of the indicators except the indicator on what to use the result for. So we need to identify those with suppressed viral load who are referred to less intense model of care. And then for the second cascade in 2019, you can see that only one indicator was available. So the number of people living with HIV who are unsuppressed, while the countries didn't have data on the rest in terms of adherence counseling and what happens after you get your second viral load. So LabCoP focuses on ensuring that people living with HIV who are eligible for a viral load test actually get the result. And we can see that in the early years, this country had access of 56.8%, but as the years went by, access has improved from 63.3 to 73.6 in 2022. In terms of getting data, we understand that data for the second cascade is usually housed at the facility level, but we advocate that this data needs to trickle at national level so that decisions can be made. For example, you would also determine how much of second-line medication or third-line medication that you would need to purchase as a country if you have this data available in real time. So then I'll tackle the second tool, which is the GHSA LABNET scorecard. This scorecard is used to assess the laboratory network and system functions. And so we can take the network as the triangle at the center of this diagram, and it shows the tiering of the lab network as national, regional, district, health, or community. So for this example, we have 5, but other countries might have 3 or different levels. And usually around the network, we have laboratory systems in place like quality workforce, infrastructure, the limbs. And so the tool looks at how the systems work together to ensure that a laboratory network can achieve its functions, including clinical diagnostics, including supporting public health, including integration, and also having a One Health approach, and also issues of ensuring cost effectiveness. This tool is applied every 2 to 3 years. So here is an example of that country A, and here we are looking at the national policy and plans, and we have the area of presence of policy that addresses international health security. We also have a strategic plan, also an operational plan, and also a mechanism for registering laboratories in countries. So those are the indicators under that. And as the other one, we showed the viral load, we also indicate to the countries what are their lowest score. And in this case, we have 6 levels for this tool. Black shows that there's absence of key attribute. Red is foundational level, and the highest is blue, which is attainment of international standard. And as we said, you're only strong as your weakest link. The overall score for that domain is a 2, showing moderate level. So the country needs to work on the inclusion of international health policies to strengthen their national policy, and also to strengthen their mechanism of registering laboratories within the country. And we also look at the progress of whether that country on this domain, did it remain stable or it made some progress. So here it shows that there was progress in terms of score. We can also look at it in form of the spider chart or spider web, and the blue represents baseline assessment and the red is a follow-up assessment to show that within some domains there have been improvement over the years, while in the domains of infrastructure, there's no change. So that's a way also to see how your scores are in each domains against the international standard. The third tool is called the Integration Readiness Assessment Tool, and it assesses the readiness of laboratory systems to deliver integrated diagnostic services. And we have a qualitative section that looks at 4 key capabilities. So these are preparation and planning, network design, support systems, and data for decision making. The tool is applied every 2 to 3 years, and there are examples of countries that underwent these assessments. So we have South Sudan, we have Ethiopia, we have Botswana, we have Sierra Leone as examples. So similar to the LabNet scorecard, the scoring is the same at 6 levels. And for this country, under policies, guidance, and regulation, where we have 3 indicators, there were weaknesses found in 2 indicators, which are the national essential diagnostics lists in place, and if it is based on evidence, and 2, on the national procedures for adopting new tests on already approved platforms. And so the score is 1, and that's foundational level. So the country needs to work on strengthening its policies to address integration, and also to develop a national essential diagnostics list based on evidence, and also try to have an abbreviated process for adoption of new tests. Again, we can use the web diagram to see how far we are from the attainment of international standard across those domains. The last tool is the laboratory mapping tool, and it is used to determine where laboratory capacity is located within a country, so GIS data. And it looks at the profile of the lab. It looks at staffing. It looks at the available infrastructure. It looks at the testing menus of the different laboratory departments. We have quality management. It looks at the issues of LIMS and linkage to laboratory networks. So basically, sample referral, the issues of biosafety and biosecurity, which are the major equipment that are available, and what are there supply chain management systems in place. So here's an example of one country, and it shows the tier of laboratories. So the green shows the high tier, which are national. The red shows intermediate tier, and the lowest, which are peripheral, are the black ones. And you can see there are more peripheral sites compared to national. And then you can also distinguish between those that are private and those that are public. You can also summarize the capacity in terms of human resource and identify gaps, but you can also map the testing capacity, maybe like looking at the Africa CDC priority pathogens, what are the diagnostics in place, and how many labs within the country are actually able to test some of these pathogens. So what do we learn? So there was a survey that was conducted as part of the evaluation of the LabCoP, where there were 67 respondents from LabCoP, and the question was, do the results from the country assessment provide any useful insights in prioritizing laboratory systems that requires strengthening? And a majority either agreed or strongly agreed, and 6 did not have an opinion. And then we asked, are the country assessments and work plans informing your major laboratory priorities for inclusion in PEPFAR, COP, and Global Fund requests? And again, we see that a majority strongly agree, but there were 13 who had no opinion, 3 disagreed, and 1 strongly disagreed. And that made us to ask the question, are the reports reaching all the relevant stakeholders so that they can be used for funding requests? Then we also asked in another survey of 16 LabCoP countries where we had 55 respondents, are the consolidated reports useful in highlighting weaknesses? And about 96% said it's suitable to be shared with programs and the Ministry of Health. And another majority said these reports clearly highlight areas for system interventions. And the consolidated reports bring additional value compared to previous years' understanding. So we also asked, who should we share this report with? And the majority of respondents actually said it should go to the Directorate of Laboratories or Diagnostics. So how do we improve the process? So the whole process is highlighted here, where the country does a viral load self-assessment. The assessment, then results are then summarized and shared with the country team. And some country teams, the LabCoP team is led by the director, while in other countries, it's not by the director. And then those reports were then used for work planning. And then the work plan informs funding requests. But the new way that we want to do it is to bring together all the assessments within the country. So not only the viral load self-assessment, but the others that I've mentioned. And those assessments are then analyzed, and the results are put in a report that highlights the gaps and strengths. And I mentioned that some countries even already have like 5 iterations of the viral load assessment tool. How do we help them to track that? And Michael will talk about the dashboard that we want to develop. And those consolidated reports now should go to the country team, leads, and also the lab director. And then those work plans can then be used to develop funding requests and also to improve the laboratory strategic plan or develop national essential diagnostics list or other ways of strengthening the lab system. So the reports, this is a process that we want to continue with, where we provide more evidence rather than only for viral load, and those can then be used for developing funding requests that can in turn lead to improvement of laboratory systems and improve the patient and public health outcomes. And we continue to monitor those activities that get funded. And so, for example, in 2022, at least 83% of activities that the countries included in their funding requests were actually funded. So there was intervention there. So in conclusion, LabCoP has established a useful system that allows countries to document progress or lack thereof in laboratory system capacity. We see that in those cascades and in some of the assessments, you need more than just the lab to answer. So there's already lab clinic interface because we involve the programs, we involve clinicians, we also involve the civil society as part of these discussions. And finally, there's increased access to national data that facilitates evidence-based improvement of national testing systems. So I'd like to thank the LabCoP members, and here's a picture of those who were able to attend our satellite meeting at ASLM 2023. Thank you very much.
Thank you. Thank you very much, Collins, for again running us through the tools that we're currently using. Just to note that some countries are using all, some countries are doing 1 or 2 or 3, not all the 4 of the tools. And again, also highlighting how some of the results are being used and how they should actually be used. Colleagues, now that we're done with the first presentation, you can actually get your questions or comments coming through the chat as we prepare to get the second presenter in, and then we'll deal with those questions and comments at the end of the second presentation. So at this point, let me invite Michael to take us through the second segment of our presentation today. Michael, over to you.
Thank you, Francis, and please confirm that you can hear me clearly.
Yes, just get close to your mic.
Thank you, and thank you so much, Collins, and thank you, team, for joining the call today. I'll take a few minutes just to highlight the dashboard that we are currently building that will be containing country-specific data. But the first question then that we need to ask ourselves is, why do we need a dashboard? The beauty of having a dashboard is, number one, it gives you real-time visibility into your performance. As Collins highlighted, there are countries that we have been involved in this assessment, and they have done multiple assessments across the years. And therefore, it makes sense to consolidate the performance into one place, a go-to place. And then the dashboard allows you to do that. The second one is provide a comprehensive overview, such that when you're making decision, or for example, in an event that there's a specific domain that you would want to see how that domain has been performing, then that you get an overview of how that has been across the various years. And as you would agree, it's not always easy to bring data from assessment, all of it into one place. Sometimes the tool and the process that we have been using might have changed. For example, I remember a time we would populate this into one document, and then we moved into an Excel-based template that has some kind of visuals in it. But now bring all that together can be a little bit problematic. And therefore, having a dashboard allows you to streamline that into an intuitive visualization. And that's the journey that we are embarking on. For a start, we are starting with viral load assessment and integration assessment for those countries that have done them, going back to when you started doing them, and making sure that we consolidate that into a dashboard. We continue building those dashboards to make sure that the data that you are generating from your country that you use in your planning is available in a one to go to place that you can be accessing. What we are looking at right now is the welcoming page that will be welcoming you when you go into a dashboard. And this dashboard, as Colin highlighted, will be a country-specific one, such that when you go in, if you are Eswatini, you'll be seeing data specific to Eswatini. If you're Ethiopia, you'll see data for Ethiopia. If you're Burkina Faso, you'll see data for Burkina Faso. And then that is linked to the team or the contact person and the team that are coming from that specific country. When you get this is what will be welcoming you. And if you have not received an email as of now, you receive an email before the end of the week, basically that allows you to access your country-specific dashboard. It will be welcomed by this overall summary of what LabCoP is about and the kind of assessment. As the assessment as we keep on building the dashboard, then you expect this part of the welcoming screen to also integrate any other additional data that you're bringing into the country dashboard. And then you click on any of these. If you are interested in viral load, you click on viral load. If you're interested in integration assessment, you click on integration assessment. Or as we continue building it, whatever other data you'd want to interact with, that's where you click. For example, now if you look at viral load, this is the way it will be looking like. Collins has highlighted this already, and I apologize. Probably it may not be very clear, but when we go to the live demo, you'll be able to see that in a more clearer way, because I'll be able to expand it a little. I've just blocked this part here so that because we don't know which country that would be. But here where we have this blue rectangle is basically a map of the country of your respective country. We'll be looking at, for example, this country. You will see they have been doing assessment from 2019 all the way to 2023. And you can see the various domain. This is summary of the domain. I hope you can see where the cursor is at the first table there. And you see how that domain has been performing. The various domain have been performing across the years. And therefore, in an event that you have a domain that is retrogressing, that is going back, for example, maybe it was a score 3 the previous year, and now it has gone to score 2. That gives you an opportunity to ask yourself what might have happened that might have resulted to that. For example, there are some specific domains that look at availability of documents and guiding document, for example, waste management, and therefore you wouldn't expect them to retrogress, whereby a score drop across the year. So we expect either the document have been put in place, they are being implemented, and they are being institutionalized. So a drop in the score then calls upon you to look back and ask yourself what might have happened. So that, again, the capability maturation that Colin talked about, the various stages that you might be in from stage number 1 to stage number 4. And then we look at individual questions to see where then how the individual questions that are within the tool, how that has been performing across the years. And looking at it that way, you're able to tell how whether there are specific areas that we need to work a little bit more on, or where we have made some good progress. Collins also mentioned about the availability of data. The data that you share with us, then you'll see it here, where the green dot indicate that data is available, and the red dot, that data is not available. And then are you able then to track your respective cascade, the cascade of those clients who are very suppressed, who are accessing viral load, and also the cascade of those clients who are not very suppressed, who are being followed up to make sure that they get a repeat viral load, and finally they are eventually referred to a less intense model of care, assuming they are suppressed or they are switched and all that. So this allows you at your level to see that data and to appreciate the progress that the country has made from the time the country joined LabCoP to now. It also could be that when the previous assessments were done, maybe you are not joined the ministry, and therefore you get to appreciate what your colleagues who were in the ministry then, how they had related their own performance then. Again, for integration, it's the same thing. There are various capabilities that we look at, but the same concept, we have adapted the same concept so that when you're interacting with the dashboard, it becomes more intuitive for you to ask questions to yourself and look at areas that what is the data telling you, and how then can you use the data that the result that you have to inform your planning. Because this is not very feasible, and I appreciate and apologize for that, I would want just to take you to a live demo so that we go there. And for this live demo, I'm going to use Kenya as an example with consent from the Kenya team. As we have said, we would want to make sure that only a country is only able to see their respective data. So this is the way the dashboard will be looking at for Kenya. Basically, the homepage, I've talked about the homepage and what will be in the homepage. I don't want to repeat that. I would want just to go right into how the dashboard will be looking like. So this is for Kenya, and for whichever country you come from, the 23 country, if any assessment have been done, you will be seeing your results. And for example, for Kenya, you can see how demand creation has been performing from 2019 to 2023. And you start appreciating where there might have been a drop and where there might be an improvement. And then the beauty of looking at this across the years allows you to appreciate the progress that the country is making or the areas of improvement that the country needs to work on. The colors that you see in the table that you can see here, and this is the sample. Allow me to go back for only a minute. For example, demand creation normally has 4 questions that are highlighted here. We have questions that look at the strategies for viral demand. We have the awareness campaigns. We have the strategies for engaging various stakeholders and the training program for clinicians on the importance of viral load. So you will find that those are the main questions. That's why the question normally focuses on. And as you know, for the capability maturation model, the place where you're performing the least become your score. That's why, for example, for 2019, unified demand creation was at 3. 2020, it was 2 at 3 because the list was at 3, and that's what is going on there. And that is the same approach that we use in our capability maturation model. And an event you'd want to interact with this table a little bit more. It allows you to do that. For example, if I maximize that, then you're able to look at this table and appreciate how the performance has been across the years. In case you do want to look at HIV testing, look at how has the country been going across the various years. If there's a drop, like you can see a drop here, then you're able to ask yourself what might have happened that are necessitated that of course that this drop that we are seeing, or where there is an improvement, what did we do differently for us to have improved? And that become conversations that are held at your level during when you are doing your planning and your work planning, and even funding request. So you'll be looking at how the country has been progressing across the years. And that is the way the integration, the viral load assessment is structured. I'm very conscious of time. I would want to allow some few minutes for us to have some questions. And the same thing, the data that is available then is highlighted here, and you're able to interact with the data for your respective country as you reported that data to us. That is, and in an event you do want a specific year, just focus on specific year. Say I want only to look at 2022. Then you're able to look at 2022 data only, and then that becomes the place whereby the focus is, and you can look at the performance for 2022 only. And you can keep doing that for whatever year, for whatever domain. Of course, I want just to look at the domain that talks about demand creation. I can zero in on and just look at demand creation. By just clicking on demand creation only, I'm able to see how demand creation has been performing across the various years. And the beauty of this is bringing that level of intuitiveness that allows you to make decisions by focusing on a specific area that might be of interest to you when you're doing your planning. That is it and if you click on it again, it goes. So if I want viral load, HIV viral load, again, it will take me there and show how that this Kenya country has been performing across the year. So when you receive the login, you will receive something similar to this, but the data would have been customized to your respective country. Quickly going to integration, and I'll only take a minute to walk you through this. Integration has the six step if you count zero, from stage 0 all the way to stage 5, and then you're able to appreciate how the various components and sub-component performed when you did your assessment, specifically for Kenya. You can see how, if you want a specific, if you want an area of policies, you can look at policies and you see that's what was at 1. And then you're able to see the questions. If you allow me to go down a little bit right here, you see the questions that are focused on policy guidance and regulation. You can see the question and you can see why Kenya scored 1, because at that point, there wasn't a national essential diagnostic list. But I'm happy to report that Kenya has since developed this. By the time we were doing the assessment, this was not there. And I believe this was one of the process that necessitated the development of the NED that Kenya currently have. So this is the way the tool is structured. It allows you to interact with your data, and it allows you to look back at the previous assessment when those have been conducted, and it's customized to your respective country so that you only interact the data from your country, and that is the way the dashboard is structured. In the interest of time, I would want to stop there, but just to the final thing to say here, what are the next steps? The next step is that you're going to receive an email, and the email will be giving you a link to the dashboard, and the dashboard is customized to your respective country. Thank you. I hand you over to Francis in the interest of time. Thank you.
Thank you. Thank you very much, Michael, for taking us through the dashboard that is generally work in progress. Like you rightly indicated, we have 2 assessments that are already captured, and we'll continue working on making sure that the other tools are also built in the dashboard. Our expectation is that countries will start using this as the building work continues, so that if they need anything, I think the 2 that you chose to start with are the ones that most countries are actually currently applying to their systems. And so thank you again very much. We have questions that are beginning to come up in the chat. And so kindly, please keep them coming so that Collins and Michael can deal with some of this. I'll just start with you, Michael. There is a question that was sent to me directly, and someone is asking, who are the people in the country that will be receiving the login rights?
So thank you, Francis. Currently, we have the list of the LabCoP member team. And within that list, we have the LabCoP team lead. The first assignment is the LabCoP team lead and the M&E counterpart. But whatever guidance we receive from the country on who else need to get the login, we will default to what will be advised by the country. Thank you.
Thank you. Thank you very much, Michael. Collins, this is specifically directed at you, and I don't know why people are sending those questions directly to me. Colleagues, kindly send the questions through the chat so that we can all benefit from them. The question is related to fluctuation in some of the scores in either some indicators or domains. And the question is, what in your experience would explain why some countries would score highly in one year and then another year they actually begin dropping, especially at the lower scores where we're looking at availability of guidelines? The higher scores, probably it is easily explainable because it is on application. And so sometimes maybe the application bit has gone down, but just your insights on why you would see fluctuation in performance of some indicators and domains across countries.
Thank you, Francis. Yeah, that's a good question. And that really has informed the development of the dashboard. So one, you have to appreciate that this is a self-assessment for the HIV viral load. And as we said, there could be time turnover so that a new team, when they come, they actually apportion different scores. But even in the tool, there are some indicators that might change over time. So like if you look at sample transport, there could be changes in terms of the rejection rates. If you look at turnaround time, those could change. So those could also result in a change in the score. And finally, under supply chain, there are cases of lack of kits. So have you had a stock out maybe in the last 12 months? So if yes, your score would definitely change depending on the year that you have the stock out. But we intend to improve this, especially where there are documents. As I mentioned, you could have a 4 where you are continuously using that document to improve that domain. But as you rightly say, sometimes that continuous improvement then stops, then probably your score might come down. But for each of the indicators, there's always an opportunity for the countries to provide a narrative on what has reduced their score within that indicator. Thank you so much.
Thank you. Thank you very much, Collins. And I think the next question will go to Michael, and this relates to the suggestions that are being made to revise some of the assessment tools. I know that we actually also sent out a survey for people to suggest or make comments on what they think about some of the tools. And we are yet to analyze what the responses are and what the effect will be on some of the tools that are out there. And so, Michael, the question is, if the tools are going to be revised, how will this have, I mean, what effect will this have on the historical performance and weighing those in historical performance against performances that will then be attained using the new versions of the tools? I hope the question is clear.
Thank you, Francis. Yes, the question is clear and a very valid question. But unfortunately, I can only answer it once we look at the extent of the revision. We normally say to the extent possible, for purposes of reliability, we need to keep the tool as stable as possible. But I can only answer that question comprehensively once we look at the kind of revision that will be factored within the tool. One of the ways that we would try as much as possible is, even with the revision of the tool, is to make sure that the historical data and performance is still available to the country teams. But again, as I said, it's a question that can only be answered once we look at the extent to which the tool has been revised. Thank you.
Thank you. Thank you very much, Michael. And again, colleagues, continue getting those questions coming through the chat so that I can only be focusing on one device and not multiple devices. Now, the other question is on data entry. And so for now, you've captured the development team has captured the historical data to 2022, 2023. And so going forward, this year we'll be doing another assessment. Will there be a function for countries to do their own entries into the dashboard, or this will be centrally managed by ASLM? And so countries will do their assessments, and then once the scores are ready, the reports are ready, those filled out tools will then be sent to ASLM, and then we'll do the entries to have those captured in the dashboard. Michael, over to you.
So, yes, the data entry process will still be managed in terms of what goes into the dashboard, will still be managed from this end, but it will be reflecting what has been captured at the country level. So once the conversation on the revision of tools is concluded, if we decide that, if the decision is that there are going to be major revision on the current tools, then that is that we'll see the extent to which that then can be factored within the dashboard, and we believe they will be factored within the dashboard. But the expectation is the country will do the assessment, the country will transmit the scores of the assessment. The scores of the assessment, then from our end, there's some little data management that we do to flatten the tool and all that. Those processes, we do them internally to ASLM. And immediately after that, then the dashboard is updated. So we don't expect there are going to be a major lag from the time the country does the assessment to the time the dashboard get updated, because it's a fairly straightforward process that we'll be doing from our end. So to answer your question, yes, the country does the assessment, transmit the assessment finding with using whatever processes that we currently have, or whatever changes that, whatever recommended process that might have been put in place by the time you're going to another assessment. Then we will do data management from this end, and the country dashboard will be updated. Thank you.
Thank you. Thank you very much, Michael. Charles, kindly translate for me the comment from Veronique that is in French, or Mariamo if that is Portuguese, and drop it in the chat so that we can deal with that. But we have comments from Francis Tamba, from Consolata Guma, and they are really very appreciative of this initiative, and in their opinion, this will really make their work much easier, and really one go-to place, like Michael, you indicated, so that then when they're doing their next assessment or making decisions during their work planning, they have something that is really quick to refer to. I am just trying to look for that last one, but if not, we are just 4 minutes away from the end. Charles, if you can get that coming through, it will help me quite a lot. It looks like it is a question, and hopefully it has dropped. Not yet. So we will deal with that question. So let me just get to Michael to give us his closing remarks, so that I'll wait for Collins to deal with that question before giving us his final remarks. Michael, your final remarks given the session today.
So thank you, Francis, and thank you, country team that have joined the call today. As I said when I was starting my presentation, this initiative will only be valuable to you if we are using the data that is contained there. That's number one. Number two is that we need to make sure that the data that we are putting in there is a complete, true reflection of the situation on the ground, so that when you are using it, data is valid. So I urge every one of us to make use of this tool, the dashboard, so that when you are doing your planning, the planning is informed by data coming from your assessment. So thank you very much. I'm looking forward to working with all of you to making sure that we keep on improving the dashboard, so that the dashboard can be responsive to your need. Thank you, and over.
Thank you. Thank you very much, Michael. I just want to read the comment from Veronique.
It's a question.
It is a question. You have it, Collins, right? So kindly deal with that question and then also give us your closing remarks. Collins, I can't hear you.
Francis?
Yes.
Yeah, so the question is about how we maybe interpret results to other players like the program. So that's what we are trying to do with the consolidated report. I mentioned that we have annexes where we indicate to the country what are the next steps they need to take to improve their domain. So we'll continue to do that. Even as we have this dashboard, we will still send those guidance on what to do for each of the domains. But otherwise, I'd like to thank everybody for participating And we look forward to also including additional tools, especially for TB. Now that there's a TB standard out there, we'll be helping a few countries to adopt this and also to monitor TB among other diseases. Otherwise, thank you so much for your engagement, and we look forward to continued collaboration. Thanks.
Thank you. Thank you very much, Collins. And I'll just use the last seconds to thank everyone for joining and encourage those who have not responded to the survey on any modifications that you're suggesting to the tool to please do that, because we'll be reviewing some of those suggestions in just a few days. Also, those who may not have sent us any document related to some of the assessments that you've done, kindly do that. With those, we'll then take this opportunity to thank you very much and have the best of the remaining part of your lab week. We again hope that you will have some time to celebrate with your teams out there, given the great work that we can currently do to protect the future of the people that we serve. Thank you, and over from us.